Hello, everybody. Dr. Hartwig here with Atlas Health and Wellness. I'm a doctor of physical therapy and the owner of Atlas Health and Wellness, a wellness company. And today we're going to be discussing some statistics on osteoarthritis. Osteoarthritis affects 23.7% of the population. That's 58 million people. Arthritis is the most common in women, affecting 23.5% compared to men at 18.1%, and more common among adults with fair or poor health. That's 40%, compared to those with excellent or good health, which is still 15%. So I plan to discuss this and a concept or a disease process called sarcopenia, but I wanted to go over some important statistics regarding the prevalence of arthritis in the aging population. And right now we live in a population that is kind of like an upside down pyramid, with the oldest being the largest group of people and the youngest being the smallest population. And this is extremely important to take into consideration when you're managing your health and investing in your long-term health. And I say that because the Medicare system and the system in which most people receive care via insurance is going to be in trouble in the next decade or two. And the reason is because of the upside down pyramid, that it being that there are less people putting into the Medicare fund than will be taking out of the Medicare fund, meaning more people are going to be taking out of the Medicare fund exponentially over the years and specifically over the next 25 years. And this is relevant because you need to invest in your physical wellness today. And the reason you want to do that is because there will not be enough physical therapists to provide care for as many people that need it. And there won't be money to pay these physical therapists and other providers to provide the care because, again, there is a limit to how much spending can occur. And there is a large amount of our money being spent currently on Medicare recipients needing knee replacements, physical therapy, etc. So I'm making this message to warn those of you that are, maybe in your 40s or mid 50s, that you need to invest now on making sure that your body and you know how to take care of your body better than everybody else, because this is an investment for you. Our wellness exams are 100% free. So, and we focus on empowering people to avoid problems like osteoarthritis. So let's see. Future arthritis burden. The prevalence of doctor-diagnosed arthritis is expected to increase in the coming decades. By the year 2040, an estimated 78.4 million adults age 18 or older will have doctor-diagnosed arthritis, compared to with 58.5 million adults from 2013 to 15. 2/3 of those with arthritis are expected to be women, and that's because of hormonal differences and weakness associated with sarcopenia, which we're going to discuss in a second. Here is a graph showing arthritis, the change in number of individuals that will develop arthritis as the pyramid moves forward, or as more people get into the age of needing care for arthritic conditions. So as you can see, it's going from around 46 million in 2003, give or take, and is projected to hit 78 million by 2040, which isn't that many years from now. So that's a large chunk of the population that's going to be affected here. And now I'm going to pull up sarcopenia. So sarcopenia starts as early as age 30. We all begin to lose muscle mass and strength gradually. Some of us lose it more quickly than others, and this is called sarcopenia. There's a couple of reasons sarcopenia can occur. There's age-related changes, such as changes in your hormone levels, cellular changes, decline ability to convert protein into muscle, and that's the gastrointestinal tract in terms of our ability to do that, and our liver's function. Lifestyle factors: inactivity, lack of exercise, prolonged bed rest, loss of mobility, low protein calorie intake, dental oral problems. We can't fix necessarily the other, the latter two in the lifestyle factor. And then there's chronic diseases such as bone and joint disease like osteoarthritis, metabolic disorders such as diabetes, liver and kidney disorders, cancer, malnutrition, cardiovascular disease, and dementia. And I would argue that they are all linked together. Sarcopenia affects the musculature, and we're not very good at defining sarcopenia. And it is often underdiagnosed. And let's see what it says. Despite being common among older adults, awareness of the condition is low among people of all ages and many clinicians. As a result, it is underdiagnosed and undertreated. So what does it suggest that is necessary to prevent sarcopenia? Let's see. So proper nutrition and exercise are currently recommended strategies to prevent the progression of sarcopenia. Physical activity, particularly resistance-based strength training, is recommended for any older adult suspected of having sarcopenia, both for secondary prevention and treatment. So what does that mean? That means that individuals should be strength training, okay, to help prevent sarcopenia. Here's the problem. Okay, most people don't know how to strength train effectively. They don't know where their areas of deficits are. And you can strength train, and it may and most likely will lead to osteoarthritis. So we have this vicious cycle here where you're losing muscle mass, you're losing strength as you age, and also you're developing osteoarthritis, which will further prevent you from doing physical activity. So Atlas Health and Wellness was created to intercept this incoming problem. And we do that through strength testing, dynamometry. We have some really cool software that can help pinpoint areas of weakness so that you can exercise effectively without causing your joints to become inflamed. The inflammation, the minor inflammation that occurs with exercise, although it's well intended, can lead to the development of osteoarthritis, which then puts you out of the game of exercising, which will progress sarcopenia. So there's this vicious cycle coming, going on here. And it's very preventable if you know how to exercise for your body to address deficits in range of motion, deficits in flexibility, deficits in strength, and making sure your body's well calibrated so that you can do weight-bearing stuff and strength training, and that you can help prevent sarcopenia. Again, I am warning you, the populace, that we're in a very big problem when there's not going to be enough healthcare providers to care for the number of people that are going to develop these problems. So I'm reaching out to you guys and saying, look, invest in yourselves, get your wellness evaluations today. Let me and Atlas Health and Wellness help empower you to help fight off the possibility of developing not only sarcopenia, but osteoarthritis and osteoporosis. I keep wanting to say that, but osteoporosis, one of the main things that you can do to combat osteoporosis is strength training, especially weight-bearing strength training. And for you ladies out there, you need my help more than you know. I know you take your Zumba classes, and I know you think you're doing well by yourself, but what you really need to be doing is working with someone that can help pinpoint your areas of weakness so that you don't hurt yourself taking classes with these group classes. I see it all the time. And at any given time during my 12 years of practice, I'd say 33% or more of my patients were hurt exercising and well-intentioned. So schedule your wellness evaluation with Atlas Health and Wellness today. Our phone number is 954-932-8527. My name is Dr. David Hartwig. If you have questions, you can reach out to us at info@atlashealthandwellness.com. We look forward to making your acquaintance and changing your life one week at a time.